All right, we've reached the top of the hour, so we'll go ahead and get started. Appreciate everybody that's joining. Want to be really sensitive to your time, so we're going to get started on time. Welcome everybody to our webinar today. We're really excited about this one. I'll be playing a little bit of host. I don't have too big of a role today, luckily. I've outsourced that to others on our team, but. My name is Jeremy Wynn. I'm the Director of Sales here at Healthcare Compliance Pros. And we've been wanting to talk about this for a little while, but we just launched the first part of this year, a brand new product for us called SENTRY. And we're going to talk a lot about that today. For those of you who are joining, if you use us for compliance, for HIPAA, OSHA, your corporate compliance, we're grateful for you as customers and really excited for you to see these additional opportunities that we've built to really help you to continue to navigate the fun waters of what is regulatory compliance from a federal and state perspective. For those of you who may not use us as clients, and maybe this is a bit of an introduction, we're really excited to hear you learn more about healthcare compliance pros today and in one of our service offerings. So today's webinar, just a couple of housekeeping items. Please submit questions during the webinar. We will be monitoring the Q&A section. Some of those that are applicable during the presentation, we'll interrupt our speakers and try and ask those questions in a live fashion. Otherwise, we'll hold them to the end and address those at the end. There will be a recording of this sent out to everybody as well as all the slides as well. So you don't need to vigorously take too many notes. We should be able to send these to you. And I'm excited to introduce those that will be presenting today. We've got Adam Laing. He is the CEO here at Healthcare Compliance Pros. He was really excited to jump on and take lead on this webinar today with this new product. And then we've also got Kira Perez. She's on our coding team. She's a senior coding analyst, really, and also kind of plays the role of project manager with a lot of our clients that we're supporting from a coding audit perspective, and also with this new product, SENTRY, that you'll learn about more today. So that's the introduction. We're really excited to have everybody here. Again, please ask questions as we go. And with that, I'm going to turn it over to Adam Laing, who's going to start this webinar off.
Thanks, Jeremy. I'm really excited and appreciate that introduction to not only talk about SENTRY, as Jeremy had referred to, a new platform that we have and are really excited about coming out this year. I will give a little bit of context to talk about, especially for existing clients or even prospects that are joining us today. When we think about SENTRY and where it positions itself and how that is against the backdrop of what we're doing with our other regular business, which is helping out to maintain compliance with HIPAA, OSHA, corporate compliance, all of those things. That's kind of the backdrop that I think makes sense to start with our conversation today. And really focused on risk before payers do, where this aligns and what we have found historically, that many of our clients, as we help them through ensuring that they've got the 7 elements of an effective compliance program in place with our SaaS software, with our support teams, and everybody that's working alongside of each of our clients today. One of the things that we have anecdotally run into or have found is that there's concerns and issues when it comes to coding, billing, and what about staying and maintaining compliance within those realms. Historically, we have done a lot of audits. Jeremy had talked about Kira being one of our senior analysts, and also that team being run by Laura Schiffman. We've had a lot of great success in doing audits for various clients, helping them to determine where risk is and helping them to find areas that need to be fixed, if you will. Over the years, that what we've found, though, and I'll dive right into this as far as the introduction into SENTRY, is that what's happening in healthcare today is increased scrutiny. And really where that comes from is if you think about CMS, Medicare Advantage, our commercial payers today, they are figuring out how to reduce their spend. How do they, audit all of the necessary places? How do they take on the complexity of the regulatory regime and understand how they can really expend their resources. So what they've done is they've increased their technology spend. So instead of looking at this, from encounter to encounter, they're really leveraging technology, algorithms, if you will, to help them determine where they're going to spend their human resource time. Where do we determine where we're going to audit? So what's happening is they leverage this technology. It is absolutely increasing audits because they're more focused, and that you're feeling and getting a sense of this payer scrutiny. In turn, this means growing documentation requirements because they're also able to look at, from a population level, how do we determine where the risks are, and then going in and auditing based on that. Now, this is also working hand in hand from a regulatory standpoint. So when you think about the Office of Inspector General and the Office of Civil Rights, as the scrutiny increases, this also bleeds over into the enforcement side of things. So what this makes for is an environment that is more difficult when you think about reimbursements, when you think about running efficiently within your own staff and your own resource allocation that you have. So that's part of really what we're addressing and talking about when it comes to SENTRY, and how we can continue to leverage that for each of our clients or prospective clients, in ensuring that even though we're going through staffing shortages, we're relying on a lot of manual processes, how can we really help effectually with those impacts and what we're finding in today's environment? What it means for each of the organizations that we're working with and what we're seeing is greater financial risk. And one of the things that we've really glommed onto as we talk about compliance when it comes to coding and billing is that we found to be compliant does actually mean revenue optimization. Sometimes it's thought of, the more work that we have to do, the more we're trying to be compliant, that's a cost and a resource itself. But when it comes to coding in particular and how we want to position this, where you've got more increased rules that you're following, you've got less resources, and you can see the bottom here where it says greater financial risk. We really want to flip that on its head and figure out how can we, with less resources, really combat this. And it really comes down to, instead of looking at this from a one-off, we've got a denial, we need to look at the documentation, we need to go back through that appeal process. We really want to help get level set from a population level data perspective, because that's really how our payers, how CMS is looking at this. They're leveraging that technology across their platforms to be able to identify areas that they're going to look into and to audit. So ultimately, this negative impact on organizations, and you'll even see it further on this slide here, is that what we're dealing with today is limited coding patterns. So we've got a team that's working on that, and we're busy. We're trying to figure out, hey, is there a revenue leakage that is happening? And if so, why is that happening? But unless we can look at this from a real population level perspective, it's really hard to identify those things other than being reactive when we have a denial, when we see something automatically get down coded, which is what we're seeing today. And it means that we've got lack of actionable analytics. And that's no fault of each of the organizations that we're talking about. It's just, how do you leverage or get into a position where you can take technology and really put that on your side, instead of just having the payers leverage that against us to be able to help and, to increase scrutiny, to increase our cost and make reimbursements ultimately harder. Because if they're looking at this from a population level set, and each of us in our organizations are looking at this as one-offs, we're always going to be behind in trying to identify where that risk is early. We're kind of looking at it from the back end. And I know this isn't new for organizations that are struggling with this. We know it's getting harder for those deep reimbursements. We know that it's taking a lot more time and effort to do this. And so as we look at these cost challenges, ultimately what it means is that we are missing some revenue opportunities, not only in the cost that's being addressed to relook at denials, to look at why we're having that throughout the organization, but also looking at our providers, looking at our coders. This becomes a friction point that we're seeing with the increased compliance risk, that we're getting the negative impact from an organizational standpoint. This means higher audit exposure. It means, again, inefficient use of our staff's time. So really, I didn't want to, we didn't put this together to be the bad news bearers, but we do want to talk about how this really is impacting our organizations today. And the latter part of this that really Kira is going to dive into and that I'll introduce is how did we flip the script, or how are we flipping the script to make it so that this can be actionable on a population level set perspective, so that we are not just limited to small data sets, so that we're not looking at this from issues that have happened in the past and we're trying to catch up. How do we really get in front of this and are in a position to be proactive and not reactive? So we've kind of talked about the core problems that we're finding. We're not getting early on the warning system. I know we're getting some data from our payers that are trying to help us to stay within the confines or boundaries to try and help out with this, but even that type of information isn't really helping us to be proactive. And proactive, when we think about getting in front of something, it's also not being proactively being able to see what's happening or coming down the pipe. It's how do we look at this from an organizational standpoint? What are our processes and procedures to better take on the complexities that we're up against to ensure that we are going to get the reimbursements that we're due, that we are coding accordingly to be proactive. So really what I've talked about is what are the core problems, what's happening in healthcare today, and ultimately, what can we do about that as we look at this gap in the market for the need of having better coding behavior, better risk identification, and better decision making. So that's really the introduction to SENTRY that I wanted to make and help introduce for Kira to take us through really what we're doing, how we're leveraging this technology. But at a very high level, let's look at how we're closing the gap. One of the things that we're able to do is leverage that same kind of audit technology that payers are doing today. So we can take a look at a population level, look at, for instance, the last 12 months of all of your claim information, all of the coding data. So rather than doing an audit that might just take 5 or 10 encounters or charts from each one of your providers, which is just trying to find a needle in a haystack for looking for things that can really help improve our bottom line. What we're doing is we're taking all of that data, we're comparing it against the OIG work plan, we're comparing it against these scores and benchmarks, funneling it through the data information so that we can really give you that same technology leverage that is being spent throughout CMS, throughout payers, and commercially, and leveraging that on your side to really make a difference on how we can combat and go up against that. Ultimately, looking at that from a revenue optimization standpoint. And I don't want to steal any thunder from Kira, but the way that we look at it, just as I introduce her and the creation of SENTRY, is our Shield platform that really helps to ensure that you've got an effective compliance program. We look at that as defensive, helping to make sure that you've got all the things in place when it comes to HIPAA, OSHA, corporate compliance, your CMS, fraud, waste, and abuse, training, policies. That's our defensive approach in helping to put you in a good, diligent standpoint. The way that we're positioning SENTRY is from an offensive standpoint. Not only ensuring that you've got real compliance, but how do we optimize the revenue as you're looking at your reimbursements? We've run into a number of clients and prospective clients that have openly shared with us that they're really in a position of undercoding because they don't want to deal with the potential ramifications from an audit standpoint and worrying about clawbacks. Unfortunately, that's still an issue to purposely undercode that needs to be addressed. And so what SENTRY is really going to help do, and why we created it, is to close that visibility gap. Are we undercoding? Are we purposely undercoding? Are we overcoding? How do we really protect those assets on both sides of that equation? And really what this comes down to is revenue optimization. I'll say it again. We believe that true compliance when it comes to coding and billing is revenue optimization, meaning that it's not reducing your revenue, it's actually increasing it and ensuring that you're in a diligent spot. So that's probably the best place to kind of introduce Kira, one of our senior analysts here, and as Jeremy had pointed out, our project managers that's really on the front end and helping to implement and utilize SENTRY. She'll get into a little bit more detail than what I've shared at a high level, but we're really excited to be able to share the platform with you guys and open to any questions as far as the platform goes, how our auditors work through and utilize that. We can answer that at the end of the of our webinar as Kira goes through and gives you an introduction to SENTRY.
Perfect.
So I'll stop sharing here and let her provide that information for you.
Perfect. Thank you, Adam. It's a pleasure to be here today. I actually really appreciate the opportunity to share this product with you. We've been really heavily focused on developing this to protect you. So it's very exciting. Go ahead and get started. All right, so what is SENTRY? It's a coding analytics and auditing solution that we really designed to be a one-stop shop to identify and pinpoint those risk areas of being audited and develop highly targeted audit action plans while protecting your revenue and improving your coding and documentation. It starts by analyzing your claims data and identifying areas at risk of being audited. It also benchmarks your providers against peers of their same specialty and supports audits by certified personnel, generating clear printable reports outlining your risk areas, your scores, findings, and education. The goal is to show you where you're at risk before the payers see it. To know where your risk lies, where documentation could use strengthening, and to gain that confidence in knowing your documentation can stand the test of auditing. Our analysis helps us to identify those provider outliers, identify the amount of your revenue at risk of audit, detect the loss or overpayment potential, and help pinpoint coding patterns that may trigger denials or audits. And then we focus our audit plan specific to each provider and targeting only those highest areas of risk. So what you're looking at here is a graph reflecting your provider's billing patterns. So if we're looking at this blue line is indicating your provider's benchmark. This green dotted line is indicating your national, and then this the orange lines I kind of added in for purposes of this presentation, just to show that we do also offer a state deviation, and that's what this looked like on this example that I pulled in. So this this orange dotted line is your state deviation, and what this green area indicates is what the normal expected deviation would be. So in this case, this provider is still in the expected deviation, but he is towards the top. So we would technically want to look at something, maybe a few of them. But what it means when they're outside of that is that we consider that a spike score, where it spikes way above and outside of that deviation area. When you have a spike, it does put you at a much higher risk of being audited. However, in this case, looking at the national and state norms and the providers, they are billing way below the level 4 than the national and state, and way above on the level 3s than the national and state. So technically what this tells us is that they're probably undercoding. So this one wouldn't necessarily be targeted by a payer for that purpose, but it would be a revenue opportunity for you if they didn't have other higher risk areas to look at. So now that I've explained how we read those and how they work, I wanted to also share an example of one that really shows under and overcoding, but it's also still high risk of being audited and why. So let's analyze this graph first. This graph shows a lower utilization of the 99213 than the national, and a much higher utilization of the 4, which actually spikes above and beyond that deviation, as you can see. So this would be considered a spike in the 99214. And then in the 99215, they're spiking way below the national deviation of the 99215. So that would also be a spike, but in the opposite direction. So now the goal isn't to normalize when we're doing these, but if we were to normalize this, I just wanted to show what this would look like, right? So if we were to bring your 214 down here and your 213 up here and your 215 up here, what this would show, and just for simplicity purposes, we're going to look at just 1,000 services. So say you build 1,000 99214s, and you had a revenue of $136,000, but nationally they build 100 99213s with a revenue of 10,000, 450 99214s with a revenue of 61,000, and 450 215s with a revenue of 87,000. Now, I didn't put it on this slide, but that equals 158,000. So if we take that and we were to normalize you already have a potential revenue loss of $22,000, and that's before you're audited. So now let's say that you're audited for 214s and they're looking for any of those visits that might have been better billed at a 99213. And they come back and they do take back 100 visits worth of your 99214s for the difference between the two codes. That would put you at another loss of $2,000. So now we're looking at a total potential loss of revenue of $24,000. But they're also not going to come back and say, well, we overpaid you here, but we underpaid you here, so we'll just call it a loss. They're only going to look at things that they can get money back on, right? So this is where this can be really interesting and very helpful for you. With this level of insight, you could potentially appeal with your own audit, but that is a lengthy and often involves court and attorneys. Or you could find it with us first and audit to ensure your documentation is actually supporting the level 4 services that you're billing, or you can take corrective actions if necessary and open the opportunity for education. So when we analyze, we start with 1 year's worth of claims data, and then for your subsequent quarters, we'll run only the prior quarter. And when we analyze, we use the same algorithms as CMS and other payers, and benchmark your providers against peers of their same specialty, both locally and nationally. And then we identify those outlier providers, codes, and the different patterns. Now, these benchmarks include combined category risk, your E&M utilization, non-E&M utilization, all services by volume, all services by RVU, your modifier density, and then your time. These outliers and risk areas really do drive the audit plan, focusing on those highest risk codes. But I do want to clarify that being high risk does not mean that anything is being done wrong. All it means is that your services are being billed at a different volume than your peers. And there's many reasons for that. You can be super specialized, you can have a denser patient population, or you can be in a location where you're pretty secluded and you're the only one in the area for hours. Or you might use mid-levels. So the analysis helps us to identify which areas will trigger payer attention and then show where we want to take a closer look. So now I'm sure you guys are all wondering though, well, what kind of data do you have to provide to us in order to do this analysis? So when we meet with you, we'll ask for a file that we call a claim line detail file. Oh, I'm sorry. Tried to move the pictures and I've made them too big. So we'll ask you for the claim line detail file. And depending on the different systems, they call them various different things. But essentially what we're looking for is the number of the services you billed out line by line. And we'll need this in the Excel format. Required fields, though, will include the billing provider name or NPI, the CPT code, and HCPCS code billed, and then modifiers and the total number of units billed for each code. These 4 categories are what contribute to your analysis. And then we also ask for the medical record number, the date of service, the payer, the claim number, and the line number. All of these additional fields are what allow us to do your audit as well. And then optionally, you could include the servicing provider name or NPI, and this is helpful for the instances where you're utilizing incident 2. It allows us to identify different servicing providers than billing providers so that we could actually assess if you guys are meeting incident 2 requirements. And then patient ID or name, we include this on there, but we technically don't like to have it, which is why it's on the optional side. But some EMRs do require like a name or a different ID than what would be standardly the medical record number to locate the patient in the EMR. So that's when that becomes important. And then if you provide us the place of service code that's billed on your claims and the diagnosis codes as well, we can audit against those, but they aren't going to make or break the ability to audit. All right. Now, before we get into what we do for our auditing, I wanted to quickly just recap what the auditors do. So assuming you get audited, your results that come back are very minimal. They might put a denial code on the service lines that they've audited. And for example, just for purposes of this, denial code B, and they marked it overpaid. And then you search through the letter and you see that denial code's B definition is level of risk does not meet the level billed. Well, what does this tell you? Honestly, not very much. There's no real detail, no context, no explanation of how the conclusion was reached. So what does this mean for you? I mean, your providers don't learn from it. Your administrators are left trying to reverse engineer the auditor's thought process to figure out how to respond or if they even should. So now, how do we do it? First, our auditors poke holes the same as a payer would. And then we flip that hat around and we ask ourselves, can we support this claim or bridge the gap? And then how can we support the claim? This allows us to provide more meaningful insight, education, and recommendations without failing a claim line for minor issues that could very easily be argued in an appeal. But regardless of that claim failure, improvement or education will be provided. Now, considering historical feedback, we built an effective education format that has proven to be easily understood by both the administration side and the provider side. Our education is formatted in the format of issue, and we simply state what the issue is. In this case, we simply state what we're seeing on this visit, and then best practices, what the best practices is and how the provider can improve. Education, educating and citing regulatory sources as applicable, and then recommendations, simply how can you fix it? How can your provider fix it? What do you need to do? Do you need to take any action right now? That'll all be under there. And then lastly, we'll include a reference if that's applicable. But just to preface, not all of these will always apply depending on the issue, but at a minimum, you will receive the issue in this case, and then best practices or education. So I also wanted to walk through and give you an example of what that looks like when it's actually applied. So in summary, what this is telling us is that this visit was undercoded and might actually support a higher level of complexity. It walks through the details of that specific visit. It details the problems addressed, the exam findings, imaging interpretation, and the treatment plan. And this really is helpful, in my opinion, to make sure that the provider doesn't actually have to go back and review the record just to understand what we're seeing and how it applies to their issue. And then from there, it further explains how the E&M level and medical decision-making are determined, why they exceed what they billed, and which medical decision-making components drove that higher level. But lastly, it tells them what they need to do. Now, comparing these to generic external audits where they provide results that are very limited, or even payer audits, which are even less detailed, this gives us a much clearer level of insight and education without requiring the provider to take the time out of the day to go back and review every single record. I mean, we've already done that for them. So the goal is to present the findings in a way that's clear, efficient, and easy to apply so they can improve their documentation, protect themselves from a medical legal aspect, and build a stronger audit-proof documentation overall. Technically, our job is to pick apart the documentation, but our job is not to criticize or tell the providers how to practice. Ultimately, our goal is to provide them the education, offer the third-party perspective, and then give insights similar to what a payer is looking for. That way they can get ahead of those audits and then they can stay ahead of it. So now when we report these, we'll first meet with your client contact, whoever that may be, and we'll review those results in detail. If we have any questions that need addressing prior to finalizing those results, we'll ask those and discuss those at that time. And then once we finalize the results, we'll print those findings into an Excel report. We'll give you one for the organization as a whole, and then one for each provider individually. These reports reflect the pass rate scores, the issues identified through the audit, with links for easy navigation through the file, and then visual graphs including the pass rate trends if available, and of course the audited claim line details in case they'd like to review the notes and the associated education similarly formatted to what I've shared in the previous slide. We do format it in a way to preserve the readability in Excel as well. Okay, now to get the most benefit out of SENTRY, we do recommend using both of the analytics and the audits together on a quarterly basis. And we've designed this model, and it is flexible, but generally we would expect this to split your providers into 2 audit groups. We would, for the purposes of this, groups A and group B. So in quarter 1, we would take the risk-based audit plan and that we created with the analysis baseline, and then perform an audit on those risk areas for group A. And then in quarter 2, we would analyze quarter 1, identify if anything has changed drastically for group B before we audit them, and then perform the same process on group B while reporting and educating group A. And then in quarter 3, we would analyze quarter 2, consider the quarter 1 results and any new risk areas or trends identified in the quarter 1 or quarter 2 analyses, and then conduct a re-audit on group A while reporting and educating group B. And then in quarter 4, the process would be the same as quarter 3, utilizing the quarter 3 analysis and then re-auditing group B. And this cycle would just continue using quarterly runs moving forward. Now, our model creates an environment for continuous monitoring, which allows us to identify baseline risk, assess risk-based changes, and then auditing in a regular cycle. It also creates an environment for continuous education, feedback, and improvement, allowing for consistent provider feedback, and also continuous insight into your risk trends and documentation practices resulting from audits and education, and the ability to identify new risk areas before they become a problem. So what's our goal? Ultimately, our goal is to identify those risk areas, target those claims with the codes at risk, identify issues and the areas of opportunity, educate your providers and relevant staff, provide assurance, and then help you retain your money. Some providers may always appear high risk due to their super specialty mid-levels and patient population, but ultimately, if the provider is performing, they should get they should get paid for it. So knowing that risk, ensuring the documentation is supporting those services would be the key to passing audits successfully and retaining your money. Now, if you did have an actual issue that you were able to correct, then we would see that reflected in your risk scores, because I would expect that they would reduce moving forward. So now I did put together 2 examples of real life scenarios that I wanted to share with you of just different clients in the past that have done analytics and done the audits and how it worked out for them. So in this example, I do want to just preface with a couple of codes and their dollar values and what they mean, just so that anybody that's not familiar with them will know. We conducted a benchmark analysis on a multi-specialty hospital and did a targeted audit plan for 11042, technically, which was the surgical debridement and valued at $132. And then relevant to the story, 15002 is initial prep of wound bed at $363, and then 15004, which was surgical prep of recipient site at $404. So our analytics flagged the high use of the 11042. And when we met with the client, we uncovered that the provider oversaw and practiced in a burn unit, which typically would explain that away, but we still wanted to just review it and make sure, instead of just pushing it off and saying it's fine, Just review the documentation, make sure they're meeting all of the requirements, make sure that's actually what they're doing. But when we audited, we actually did find that they were overutilizing that 11042. And they actually supported a higher value code, the 15002 and the 15004, which meant that they were losing anywhere from $240 to $600 per patient. So the outcome of this was that the provider, that they provided assurance, sorry, and then educated providers and billers, and they were also able to increase their revenue. And now my second example is for a client who appeared to be overutilizing incident 2. So during our analysis, this provider had shown an FTE value of 4, which appears to a payer that the provider is billing the volume of services that would be expected to require 4 full-time employees to complete. After discussing these findings with the client, we identified that the provider utilized incident 2, which did then become a target point for assessing appropriate use of incident 2 in the audit. During our audit, we did identify that many new patient visits were billed under the MD and performed by an NPP. So to provide a little bit more context around this, though, incident 2 has very specific guidelines to be met, one of which being that the patient has to see the MD first and establish a treatment plan. Then the NPP can execute that treatment plan during a subsequent visit, incident to the physician's initial treatment plan. So this means that there's never any instance where incident 2 can be utilized for a new patient, and all of those new patient visits should have been billed under the NPP. So this did indicate a clear misunderstanding to us of proper use of incident 2. And the result of this was that we validated the analysis risk. We identified that the at-risk behavior prior to their payer identification, and then that allowed for corrective actions and education to be made before they became a problem. And thank you for listening. So if you have any questions, I'll turn it back to Adam, Jeremy, Josie.
Great. Thank you, Kira. Yeah, so any questions, feel free to use the chat feature if anybody has any questions. While we do that, I'll let Adam kind of take over just a final wrap up, kind of wrapping this all together while we look for any questions to come in, and then I'll close the webinar after that. Go ahead, Adam.
Yeah, thank you very much for each of you joining us today and spending some time with us. Just needed to get the CEO out of the way to really get to the meat of the conversation, and so I really appreciated Kira's perspective on there, in the sense that sharing real life examples of what we've already seen and leveraging this technology, and just one of the things that I really wanted for you guys to take away is that technology is definitely being leveraged. Not in your favor when you think about CMS, Medicare Advantage, and then our commercial payers. What we really want to do is flip that on its head and position your own practice, your own group, and your providers, and really help you leverage what Kira just talked about in a nutshell, and helping to find not only compliance. Compliance can be expensive, especially if you are not in compliance. And even historically, we've looked at coding and billing as, hey, we want to make sure that you're compliant. What we're really bringing together here is compliance does mean revenue increase, not revenue decrease. And that's both on the human resource allocation side, on what you're already trying to spend time and efforts on right now today, in a lot of time, which we're really trying to move away from, is reactive efforts, to making it proactive. So I really appreciated Kira's going through that in a really clear manner, that I hope that you can see this is something that we could help leverage for each of your groups. But certainly want to open it up to any questions that anybody has in the forum. We've also got Laura on here, who leads this department and leads this effort with us. So if you do have questions.
I actually have a few, and Laura, you might want to jump in on some of these, but first one we have, what sources do we use to benchmark locally and nationally? So we do have, we call them PUF files, or CMS calls them PUF files, but they're publicly available data that we can, that is presented to them, and then we can utilize it to get benchmarks. And then we take your data and benchmark it against that. Is that correct, Laura?
Yeah. Yes, that's correct.
Okay. And then how is the chart documentation typically accessed by SENTRY? So the documentation, we have two methods. One is EMR access, depending on you and if you are comfortable with that. We can give you our auditor's information that will be working on your project, and you can provide us temporary access for them to locate them. If that makes you uncomfortable, we also can just send you the selection that we would like to look at and provide you with a secure and HIPAA compliant SharePoint folder that you can upload those into, and then we'll audit them that way.
And one thing I'll mention on that we're working through is getting direct API access to EHR, EMR that you're using. And so where we really want to look at this, looking back, where are you guys at today, and then moving forward and helping to optimize on a quarterly basis, because that, education for your providers is so critical and so important. We ultimately would like to get access to where we can have that on a quarterly basis with your EMR, EHR system.
Then the training included is not an extra cost. We currently are offering one to two 1 hour session group trainings, or if you wanted one group training and you had one particular provider that you wanted us to meet with one-on-one. We are also in the process of developing micro trainings that we could assign based on the provider's issues in the near future. But currently it's a live training similar to this that we would present to your providers based on the issues identified in their audit.
But I wanted to point out our training actually begins in the way that we respond to the audit. So their audit findings are the first level of training for the providers.
Mm-hmm.
And those are specific to that specific situation for them.
Mm-hmm. And then this one, Laura, you might want to speak to this. They asked, how typical is it that each quarter's analytics vary by a large amount? Are you educating on similar issues each time?
So that's an interesting question. Is the way that we are analyzing them on the quarterly basis, we are analyzing that quarter, and we are we're analyzing that quarter by itself. So that way we can identify any new changes that happened within that quarter. Those are those changes. And when you have providers that go to seminars and then they come back billing for the same ICD-10 codes or the same CPT codes, and you notice when you're posting the payments that everything looks about the same. Those are those things that we'll pick up on those quarterly basis. Does that help? Hopefully.
And then it looks like, does HCP provide support for targeted audits? And yes, absolutely. We can help out with that. And hi, Amanda, great friend of ours. And on MIPS audits. So MIPS audits, we can help tangentially with some of the concerns and issues that you have, but not specific to MIPS. We've got a number of groups that we highly recommend in working through some of that. ShareCare is one that we have referred to and recommended in times past, but definitely on targeted audits, we can help assist in any way that you need there.
And then I think, Adam, it'd be good for you to take this last one. If we were looking at acquiring an office, can this help?
Absolutely. So one of the things that we are also doing with this is helping out on the diligence front end side. So looking at that again from our Shield product, do they have the, effectively the 7 elements of the compliance program in place when we think about HIPAA, OSHA, corporate compliance, CMS, regulations, a security risk analysis? We can help identify, is there, risk, and what risks are we looking at with that organization? And then certainly from the billing and coding perspective, and looking at the health of that AR that you might be acquiring. So that's something that we definitely dive into and can help you with. And I don't know if somebody already addressed this, but the training is included as part of the subscription. Essentially, you're going to have an annual subscription. You'd heard where we'll actually look at it on a quarterly basis, and I appreciate Laura's context on there. it really allows us to look back at your prior 12 months that we're doing the analysis from, get a level set understanding of where your providers are at today, your mid levels, all of your staff, and where our biggest risks are. So what we want to start seeing, really, and this is where it comes down to from an EBITDA standpoint, how does this impact you from a financial standpoint? We want to see that those changes are happening, training is happening, and then just like Laura had shared, what's the impact in that first quarter, and then going into the second. Ultimately, what we want to see there is an improvement on your bottom line, but also seeing effective changes with your providers, buying into and understanding how we can make this most optimized from a revenue standpoint, and certainly from a compliance standpoint.
Great. I think it looks like we got through all those main questions. So yeah, thank you to everybody that submitted questions. Appreciate everybody that attended today. So if you want to talk with our team specifically about your situation, your needs, when it comes to SENTRY and coding, and you're looking for help, how do we do this better? How do we find the revenue that we've actually earned? How do we identify, where our risk areas are, where we are going to potentially be audited? How do you, if you want to get ahead of the game, like we're trying to do here with clients using it, you can reach out to our team. There's a couple different ways. If you go to our website, healthcarecompliancepros.com, you'll see multiple links on there to schedule a consultation. Just mention you want to chat through some coding audit support. You can also email me directly, and I can get you connected with our team. That's jwinn, JWINN, @hcp.md. And I'll work with you to schedule some time to talk through how we can support you. So again, a reminder, we will be sending out the slides, a recording of this, so you can rewatch as needed. You can share as needed with members of your team. But other than that, we really appreciate everybody joining today, and stay tuned. We've been doing these webinars monthly on different topics. And so, we've got a few exciting ones coming up over the next few months. Josie will be continuing to share information on those. You may have heard that there might be some changes coming to HIPAA here this year. We're going to be addressing those here shortly. So stay tuned for some of the future topics. But with that, I think we'll wrap it up today. Thank you so much to everybody. Always enjoy having you join us for these.
Thanks, everyone.